Guys, it's Dr. Emer. We're in West Hollywood and we're nearing the end of the day. And we're going to do a Botox treatment today. And I like this because this is like sort of pan-facial, facial sculpting type of Botox. This is not the traditional 11 line, just stop the movement. This is kind of fine contouring, softening of folds, and evening out facial asymmetry. So my patient here, if you take a look, if we were drawing a line right down the middle, on this side of her face, she has a little bit more of a 90-degree angle. And on this side, she's more heart-shaped and more obtuse, which meaning that she's sleek and slender on one side and a little more square on the other. Bite down as hard as you can. You can see right here, the masseter muscle, if I squeeze here, it's very large, but on that side, you can relax, it's just a little softer. So what we're gonna do for her is we're gonna use Botox to kind of slim one side and soften the other. And then we're also gonna do it just preventative around her eyes and then to keep her brow and her forehead soft. Now turn a little bit this way, bite down. Okay, relax. So we can literally just grab the muscle, squeeze again, bite down again. Perfect. I can feel exactly where it is, the anterior posterior border. And on this side, we're going to do just a little bit more than we would traditionally do on the other side. Bite down. Now in Korea, they'll do a much higher dose. Bite down again, relax. But we're just doing a starting dose so that she doesn't get too slim on one side, because she likes a little bit sleek and slender, but she doesn't like it to be too slim and saggy, because what can happen is if you do the typical doses that they do over in Asia, it can be sometimes very, make someone's skin very loose there because this muscle supports like the architecture or the foundation of a house. So bite down. Now this side is very small, bite down again. We're just gonna go directly where she's feeling the muscle contraction. Bite down again, perfect, right in there, good. You don't wanna go more anteriorly because if you do, it can change her smile. So what we're gonna do now is we're just gonna do Botox in the forehead. Now some people have nice elevated brows and thicker brows and they like to have no movement, okay? So we wanna keep it where she has, raise up a little bit, relax, where she has very minimal movement, okay? One thing that's key is you don't wanna go, raise up, relax, you don't wanna go only medial, because then she's gonna get a real high elevation. Raise up again, relax, good. Raise up again, relax, perfect. Raise up again, relax, good. And she likes having a little less movement. Raise up again, relax. Raise up again, relax. So that's what we're gonna do. Raise up, relax. Little pinch on the edges just to make sure. Beautiful. And then now we're going to do our just preventative eye treatment. And when we do just a small amount, I like to do the matzo ball technique. I always tell you guys I'm from New York, my residency program, and I'm coming to you guys tonight. So turn here, smile as big as you can. She doesn't have much at all, but we're going to go right to this lateral edge, real close to the crow's. And we're just going to do a subtle little subdermal bleb, okay? We'll call that the matzo ball because we're letting it bleb up and then you just literally smash it down. It's like your soup. And what happens is there was a study done by a friend of mine in DC and she studied 3 injection points on one side and 1 injection point on the other and they both did the same. So it's less risk of bruising. Smile again, okay, relax. Smile again, relax, a little pinch, good. And again, a little bit, just get that bleb. Matzo ball. That's it. So that's Botox treatment preventatively. We'll take a look and see how our facial asymmetry balanced out in 2 weeks.